This video will include a short interview, brief monitoring of cognitive and respiratory function, followed by the oral mech exam. It's assumed that his medical charts have been checked and there were no red flags for continuing the evaluation. So we're going to begin. This is my husband, Matt, by the way. Okay. Hello, how are you doing today?
I'm fine.
Good. Can you tell me your name and your birthday?
My name is Matt. Birthday is November 17th.
Great. And what is the date today?
July 4th.
Awesome. Can you tell me a little bit about your swallowing? Like what kinds of foods do you eat? Do you eat all of your meals during the day?
I feel like I have pretty regular meals. Breakfast in the morning, lunch around 1, dinner around 6.
Okay, great. And do you ever notice any issues with swallowing during those times?
No.
Or any discomfort in the throat?
Nope.
Okay, great. And then do you have any allergies or strong dislikes to different foods?
No.
Okay, great. So cognition seems fine, and as I'm talking to him, I'm observing the grooming and his alertness, his ability to answer questions. So there's no, and his answers of no reported swallowing difficulties. So next, I'm gonna do a few things, ask you to do a few things to ensure that you have enough strength to complete some of the evaluation. Okay?
Great.
So can you cough for me? Great. Can you clear your throat? Awesome. Can you open wide and then close your mouth? Stick out your tongue and move it side to side. Okay, great. We're ready to begin. First, we're going to take a more in-depth look at some of the structures of your mouth and test some of the strength in your tongue and your cheeks and your throat. So first, I'm going to check your lips, okay? Can you pucker, please? Good. And then can you pull the corners back of your mouth, like back towards your ears? Yep. And then can you make an O shape, like O? Mm-hmm. Then can you close your mouth really tight? Okay, and now keep it closed and don't let the depressor in. Good. Okay, great. Now I'm going to have you open wide and I'm going to look at your teeth. Okay. Good. They're all symmetrical. You don't have any missing. Looks like you have good dentistry. Okay. Now let's look at some jaw function. Can you open wide and then close? And then can you move your jaw from side to side like this? Great. Okay, now we're going to do some tongue things. First, I want you to stick your tongue straight out. Good. Can you raise it up a little bit while it's out? Great. And can you move it from side to side? Good. Now I'm going to have you move it from side to side about 5 times. Okay, ready? I'll tell you when to stop. Go. Good. Okay. Now I'm going to have you, can you push your tongue against the inside of your cheek? Okay, and the other one? Great. And then I'm going to have you push against the other cheek again, and I'm going to push against it. Okay, you keep pushing against. Good. Okay, and then this one? Okay, good. Let's see. Now, I'm going to have you stick out your tongue again. We're going to use this. And I want you to push up against the depressor. Keep pushing up. Nice job. Okay, now I want you to do the same thing, but push down on it. Good job. Be strong. There you go. It's not a real depressor. It's a little slippery. Okay. And then I'm going to have you do the same things for the sides. So stick your tongue straight out and then push against it. There you go. Great. And then the same thing for that side. Good. Now I'm going to have you take your tongue against the top of your mouth and kind of drag it back along the top of your mouth. So you're going to open and drag. Okay. Good. Okay. Next, we're going to look at your cheeks. So if you could puff up your cheeks with air. Good job. And then you can let it out. And now I'm just gonna feel your cheeks, and I want you to tell me if it feels the same when I touch. If the sensory function of your cheeks is what we're testing. So I just want to make sure you have sensation in both cheeks. Okay, so like this, like that. Did it feel about the same?
Yep.
Or were you unable to feel either side? Okay, great. Okay, now we're gonna start looking more inside your mouth. Okay, so first of all, can you open wide for me? Can you pull your tongue to the front of your mouth too? Thank you. Okay, great. You have adequate hard palate and soft palate. Can I see one more time? Can you say ah for me? The uvula, there's only one, that's good. And the height of the pillars seemed appropriate. So now I'm going to have you do some sounds while your mouth is open like that, okay? So first I am going to have you do one ah, and I'll tell you when to stop, so you can just keep saying ah. Good. Okay. Now I'd like you to just do this. I want you to do okay? Can you keep your tongue? Thank you. Good. Okay. There was appropriate motion every time. It didn't seem like there was any weakness as you continued throughout those phonations. So, now we're going to do a little bit more. I'm going to have you say some more things this time. Okay? So this time, can you say pa, pa, pa? Say
With
pa.
my mouth open. Oh, okay.
We're just going to say some sounds now.
Pa, pa, pa.
Good. Can you say ta, ta, ta?
Ta, ta, ta.
Good. Can you say ka, ka, ka?
Ka, ka, ka.
Okay. Now I'm going to have you kind of say them all three like this. Pa, ta, ka, pa, ta, ka, pa, ta, ka. Okay?
Pa, ta, ka, pa, ta, ka, pa, ta, ka.
Okay. Now I'm going to have you say them fast as you can. Okay? Ready? Go.
Pataka, 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 pataka.
Good. Good job. All right, and then that should be about it. I would have him do like an S to Z ratio, but I feel like that would take a while. But in a regular exam, I'd have him do the S to Z ratio, and I'd have him do prolonged phonation, timing that. And then one last time before we end, can I have you cough for me? And can you clear your throat? Okay, that was just double checking to make sure before we do the other assessment that there's appropriate ability to prevent aspiration and penetration. So, you're ready for the swallow assessment video. Yay!